Tracy, it's a trend doctors locally are hoping to ward off rising COVID cases, particularly in our part of the country, the Northeast. The CDC believes cases will continue to increase over the next 4 weeks. It's being blamed on states and cities lifting their mask mandates and other mitigation measures. NBC 10's Deanna Durante is live in Dresher, Montgomery County. And Deanna, the rise in cases is affecting schools just as kids are getting ready to go out on their summer break.
We have some reports of some private schools that went back to masking for a day or a week or two to try and calm some of the cases. Some schools and other activities are being postponed, year-end events, concerts, things like that, just to try and make sure that the cases don't get out of control. And doctors locally say it is a trend they are seeing in this area.
Which I was going to wait, but then I keep reading more and more about people, and we know a lot of people with COVID who aren't necessarily in this area, but who have caught it so easily that I just wanted to be safe.
Natalie Johnson and her family had COVID in January.
It wasn't bad. It was Omicron. I got it from my child, so we all kind of had it, but it was very mild. I had had my second booster in October.
And while those mild cases from the variant strains were easier for some to handle, doctors say it can also make you an easier target for the virus to strike again.
The infections from all of the people that had Omicron variants back in the winter time, there's not as much protection against the subvariants that are starting to emerge now. And that's what seems to be on the rise in the Northeast, which then tends to spread across the United States.
Dr. Angela Nicholas is the chief medical officer for Einstein Montgomery, and she says if you can get boosted, don't wait any longer.
These variant strains seem to be different than what everyone got back in the winter time. And so you don't have as much immunity.
And that's why Natalie came to Eric's RX today.
It's very cyclical. We go through waves where we're busy and waves where we only do a few shots each day.
Mark Ost says right now it's the folks who qualify who come in, but it's not for everyone, at least not yet. And it does create a bit of confusion as to who should be boosted again and when.
We follow the CDC, FDA guidelines. As far as we just go off of your previous doses, make sure you meet the criteria for the second booster. It's being 50 and above or immunocompromised.
Which is why Joel and his wife showed up today for their 4th shot. And again, that criteria, 50 or above, your health status, your age, of course, and also, depending upon which vaccine you had early on, you may qualify for yet another booster now. And doctors say, while you can wait, maybe not the best idea, because while we know that we have variants that are different now from what we saw in the winter, we don't know what we're going to see come late summer and fall. Reporting live in Dresher, Deanna Durante, NBC 10 News.
Isn't that it about variants? They keep changing on us. All right, thanks for that, Deanna. Appreciate it.